Okay, let's practice the maxillary canines because these ones are tricky. So I'm going to show you exactly how to get that distal contact open. So because of the curvature of the arch, and the upper arch is wider than the lower canines doesn't seem to be a problem. You can just put that size 1 film directly behind that canine and you're good to go. You just want to center that canine in the middle of that size 1 film. The max canines, like I said, trickier because of the arch. We need to rotate that film, not shift the film. You want to rotate the film, which I'm going to show you in a second, so that the film is a little bit more behind that tricky contact, which is in between the 3 and the 4. So XCP holder, and then again, size 1 film. I will stand by that, that the size 1 film will always fit the canines the best. Size 2s are just a little bit too wide. So first step, the sweet spot, right? Up into the height of the palate, and you want to go directly behind that canine. Okay, so I know that it fits, it's nice and secure, and gravity's not on my side, remember, when I'm doing maxillary PAs, so I need to make sure that I have a good hold on this. Then what you can do is ask the client to close, so that when you close, the canine is actually in the middle of the bite block. And then what you can do is, they're not going to be biting on it too tight at this point, but you can actually show you through the ring, the bite block, and you're going to rotate the film towards the distal. I would be standing directly in front of this XCP holder and looking directly through that ring, because I need to gauge, like my eyes are locked on that contact between the 3 and the 4. So I don't want to over rotate and I don't want to under rotate. I'm aiming to get that film behind that contact. So I need to rotate towards the distal. With more practice, you will probably be able to rotate this film towards the distal before they even close. So up into the height of the palate, behind the canine, to try to get it as centered as possible. And then I would be standing again directly in front of this XCP holder, and I would be rotating towards the distal so that I have that film more so behind that tricky contact in between the 3 and the 4, and then I would ask them to close. So this technique does take a little bit more practice, and in a perfect world, everyone has a perfect straight dentition, but that's not always the case. So we really have to visualize that contact. So yeah, that's how you do it. You rotate that size 1 towards the distal a bit, and you'll be able to open up both contacts in between the 2 and the 3, and in between the 3 and the 4. Thanks.